We're learning about our kidneys today because 1 in 10 Canadians suffer from kidney disease, and many at risk. It's never too early to think about your kidneys. Great to have a naturopathic doctor, Kate Rhéaume, back on the show to look into some tips about our kidneys. And I was even talking after, or just off camera, if it's hereditary. Kidney disease.
Some are, for sure, but I would say the majority of the risk factors around healthy kidney function and kidney disease are controllable. Things like blood pressure and blood sugar. Those are the two most important things for people to pay attention to keep their kidneys healthy. Right. And those are less hereditary or genetic than some other kidney conditions.
Kidneys are pretty important in our bodies.
So important, such unsung heroes. They are working all the time to filter and clean our blood, which is a super important job. And even, in the early stages of declining kidney function, there may not be any obvious symptoms, which is why it's important to, again, keep the blood sugar and blood pressure healthy and in check, monitored, and check in with your doctor.
Okay, but then you can be eating stuff too to even help with good kidney health. What do you have in front of us?
Absolutely. So, this beautiful, colorful Mediterranean-style diet. The color means antioxidants, also things like, fruits, vegetables, beans, legumes, fish, for example, wonderful source of kidney-friendly protein, and then, of course, high fiber in the rest of the foods. That's helpful for blood pressure as well as blood vessel health, which is important for kidney health.
Yeah, and kidney beans.
There you go, kidney beans.
The more kidney beans you can eat, folks. Okay. And then, so then what are we getting into with meat and cheese? Yeah,
so meat and cheese and eggs, egg yolks in particular, great source of vitamin K2. And this is a nutrient that's been shown to be deficient in people with kidney disease, and it plays a role in, again, maintaining healthy blood vessels. Helps to prevent arterial calcification, for example. We know that's a concern when it comes to kidney health. Okay. And so good news is you can get that in delicious foods like certain types of cheeses, brie, Gouda, Edam, as well as egg yolks.
And then you can also get it in this form too.
You can, yes. So for people who may have not be eating those foods or have bone, heart health concerns, that's a great choice.
Should we be worried about over-the-counter medication when it comes to our kidneys?
Definitely. So certainly we know that there are certain prescription medications, if you're on any prescription, worthwhile checking with your pharmacist to see if those affect your kidneys. But for over-the-counters, the NSAIDs, ibuprofen in particular, wonderful pain reliever in the short term, not meant for long-term use. If you're taking it regularly, like daily, for more than even just 2 weeks, that can potentially affect kidney function. So speak to your doctor about other pain options.
What did we got last year?
Well, we've got some fermented foods, probiotics. Believe it or not, what's happening in the gut, helpful for the kidneys.
That is which?
This is sauerkraut.
Sauerkraut.
Yes, wonderful fermented vegetables.
I can have sauerkraut every now and again on the sausage.
Yeah, and yogurt, other types of fermented foods. And then fruits and vegetables that are sources of, again, more antioxidants, things like alpha-lipoic acid, helpful for kidney health. Okay,
at Dr. Kate ND, Kate Rhéaume back on the show, because it is March is Kidney Awareness Month. Hope you learned a thing or two. We have some more things that hopefully you can learn on this Monday edition of